Hi, I'm Greg Dixo, VP of Marketing at the Millennium Alliance, and I am honored to be here today with Don Novo, Principal of Health Management Associates. Don, thank you so much for joining us.
Thank you, Greg. It's my pleasure to be here today.
So, I just want to jump in, start things off. Can you share with our members a little about yourself and your company, Health Management Associates?
Sure. So, professionally myself, I've worked in the Medicaid area or sector, so to speak, for, my bulk of my professional career. So, 28 years, working both at the state level as a state policy director in Massachusetts, and then transitioning over to the federal level where I worked for the Centers for Medicare and Medicaid Services for 8 years as a Medicaid state regulator. And then the last 6 years of my career I've spent with Health Management Associates. We're a consulting firm that specializes in publicly financed healthcare. So we work in the Medicaid, Medicare, safety net space. But we also do a lot of additional work with, healthcare providers, health plans. I work with a lot of digital health entrepreneurs, helping them navigate the market, and so forth. So our depth is large. We're a national firm. We have 25 plus offices. I think we recently added some additional colleagues in a new city. So national reach, well-respected, work, within the health plan sector. I think what differentiates our colleagues are that, we're a firm of folks that have kind of done, seen, and run all different aspects of healthcare.
Well, we certainly have some great experience, and we're grateful that you were able to share with our audience the last few days. So Health Management Associates supports a lot of public health projects.
That's correct.
What are some of the best practices and lessons that can help the healthcare executives in the private sector that you see?
Well, I think there's there's a number of areas that we have, as a firm, have worked with, with the healthcare executives in the sector. I think, looking back over the last 6 to 7 years. One was we did a lot of work with health plans, public hospital systems, health systems, helping them prepare for implementation of the Affordable Care Act. Being prepared for, a large influx of a new population that they didn't really have a lot of data on. So these were people that primarily were served in the safety net. Many of them were underserved, and they had a pent-up demand for healthcare services. So we worked with our clients, helping them to kind of prepare for that influx and, try to navigate and forecast as effectively as possible what the challenges are that they were going to be seeing within, the first couple of years of implementation of that new population in their systems.
And speaking of forecasting, what do you predict for the future of telehealth, wearables, and mobile, and the increasing role that they're going to play in healthcare in 2020 and beyond?
Sure. So I think, we had a great discussion this morning about data. I think let's start with telehealth, first of all, because I think telehealth is really beginning to permeate the healthcare sector. Medicaid was one of the kind of holdouts. And now we're beginning to see, Medicaid accepting telehealth and promoting telehealth within their networks, and also as a way for Medicaid to meet a lot of the network adequacy requirements that they've often struggled with, especially in the more rural areas where there's been more of an implementation of managed care. So I think, we'll continue to see telehealth, and I think we're going to see telehealth more implemented and integrated in more kind of user-friendly public ways. So, some of the discussions that we had this morning about technologies, I think that, providers are going to start kind of implementing and making like the telehealth pathway through their member application, through, their member portal to, kind of touch the member where the member, at the level that the member needs to be at, and make healthcare more individual. So members and members will know that this is where I go when I need to, speak with my doctor via telehealth, but I can also communicate to my doctor in email and use a lot of the self-service functionality. And I think we're going to begin to see payers kind of implement more of that. And I think that kind of leads us into your next question about really like wearables and connected health, and because that's now a whole myriad of additional data that I think health plans have the opportunity to connect, to collect rather, and connect to plans of care. So I think when you look at people that managing the most vulnerable populations, people with chronic conditions, and how the use of wearables and some other technologies can kind of help care managers understand understand the areas where people have needs. Some of the interesting things, I think most people, and I know like at the assembly, if you look at most people, they're wearing a Fitbit or an Apple Watch. And what's going on in daily lives is people are using that device to communicate, but the device is also collecting a whole lot of data. It's collecting, their heart rate data, and it knows how far they're walking and where they're walking, and how that activity impacts their health. And I think that's a whole kind of untapped market right now for the ability to kind of collect some of that data, and allow people to opt in. Again, it's making care personal. Like, okay, I want to opt in and provide that data to my health plan or to my care manager, so they have a better understanding of my personal health, where I stand, or how I may have improved my activities, things of that nature.
Yeah, and that's interesting, and I think you're right. Most people are looking for a much more personal experience, and it'll be interesting to see where we go from there, and even a few years down the road where we are.
Absolutely. Sure. I mean, I think you think about health promotion. It's a great opportunity for health plans to partner with their members in promoting health and being able to provide incentives. So the collection of data, from your Fitbit or your Apple Watch can say, hey, I've increased my physical activity this much. I walk 8 miles a day now. And it really allows, I think, for a savvy collection of data that can be used to help promote health.
Yeah, for sure. So first off, thank you for being here, Digital Healthcare Transformation Assembly. What has been your biggest takeaway so far from the assembly?
I think I was very fortunate to have some conversations with a very esteemed panel this morning of payers, so large systems and providers, and I think the biggest takeaway for me from these nationally renowned experts in their field is that in order to make that digital transformation happen at the patient level, you need to make it personal and connectable for patients and for members to be able to engage in use of new technologies. And I think that's something that I'll really take away with me, knowing that you can put out, there are lots of access points for people to get information and to connect to their health care. But I think when you make it personal, it becomes more of a way of life.
Yeah, that's a great point. So finishing up, two-part question for you. What are the benefits for C-suite executives working with the Millennium Alliance, and also what excites you most about being an advisory board member from Millennium Alliance?
Sure. So, I mean, I think there are a couple different benefits. One is that it's a very rare opportunity where you can get so many so many leadership minds of great institutions in the same room talking and collaborating. And the ability to network and build those relationships and be able to continue those relationships after the assembly, I think is definitely, it's so valuable. That I've always gotten a lot out of my participation just from that perspective.
That's great. And as far as the advisory board for this upcoming year, anything you're looking forward to in particular?
Well, I'm just kind of looking forward to, as kind of the Alliance continues to expand and transform, the ability to kind of interact with, you know, a broader audience of professionals. I think as the alliance has kind of matured, you've attracted, you know, even more of a high level of healthcare professionals that are really, you know, come to join in stimulating discussion that helps to kind of move the bar forward within their organizations.
Yeah, well, we try to be forward-thinking, and having you know, esteemed members like yourself on our advisory board, you know, is helps us in a big way. So thank you so much for your time. Thank you for being here.
Thank you, Greg. I
And,
appreciate the
yeah,
opportunity.
really appreciate that. Thank you.
Thank you.